चार्जिंग चेक कर लो.
All right, everyone, thank you so much. This is a live presentation that's happening between Vicky and Nourish Talk. I am Amita, your host. I am co-founder of Nourish Talk, a holistic platform for women. I'm going to have Vicky France do a small introduction, and then we're going to go to our agenda. So please go ahead.
Ma'am, do I have the permission?
Yes, please go ahead and introduce Vicky France, which we are very excited to partner and collaborate with.
Thank you so much, ma'am. Ladies and gentlemen, honored guests, and cherished audience, welcome to a special edition of our talk show that dares to challenge the taboos and misinformation surrounding two significant stages in a person's life: menstruation and menopause. Today, we are gathered here to shine a spotlight on these natural and transformative experiences that have a very profound impact on individuals across the generation. In a world where topics of menstruation and menopause have often been whispered about in hushed tones, we believe it is a high time to bring them out of the shadows and into the spotlight of understanding and empowerment. We also acknowledge that menstruation and menopause are not only
Rishika, is there a glitch on your side?
All right, I think there is some issue with Tishika's.
It's okay. Mansi, you can continue. Mansi and Isha. To our distinguished speakers, we extend a heartfelt appreciation for their tireless efforts to promote awareness, advocate for reproductive health, and to foster a more compassionate society. Their expertise and their passion, they are invaluable in paving the way for the positive change. Thank you all for joining us on this enlightening journey. We hope that today's talk show leaves you feeling informed, inspired, and equipped to be advocates for menstrual and menopausal health. Without further ado, let's begin our transformative discussion on menstruation and menopause. Welcome, one and all. I would first like to welcome Dr. Arora, who is one of the leading Ayurveda doctors specializing in women's health. She has conducted educational webinars and sessions of the national and international level. An award-winning doctor that is at the forefront of how holistic therapies can help women during different phases of life. Now I would be passing the baton to Dr. Arora and Ms. Amita.
So I think I also would like to add Dr. Taher. Dr. Taher is a physician who himself survived heart surgery. And then now he is educating thousands and thousands of people on heart health. He's written a book called Open Heart. You know, he is climbing mountains. He is running marathons, triathlons, Ironman. You know, I can go on and on for half an hour, 1 hour. He's my dear friend. And he is so passionate about educating specifically Indian men and women on taking care of cardiovascular health. So he is here with us. He is in his mid-70s and championing everyone to live a better life, right? So the agenda is very simple. We will start with, you see over here, PCOS, and we move on to early menopause, which a lot of Indian women have, which Dr. Arora is going to talk about. And then we talk about the holistic therapies. So this is a quick 1 hour session, and I'm going to have Dr. Arora to start on this. And Dr. Arora, you're welcome to add to what we've added to your bio or anything else you like to add.
Yes. Sorry. First, namaskar to everyone from India. And I am an Ayurvedic doctor practicing Ayurveda since last 24 years and frequent speaker at All India Radio and DD National. And as from Vicky, I have got my very good introduction, and from Amita ji also. They are spreading awareness for women health, which is a very good cause. And now I will start my topic. PCOS, that is Polycystic Ovarian Syndrome. Amita ji, last slide.
Yeah, I don't know what happened here.
I would like to ask which language is convenient for listeners, English, Hindi, or mixed?
I guess a mix of both would work better.
Okay, because sometimes English goes above the head and we are unable to understand actual thing which I want to tell you. Okay. So
Just
Amita
give
ji
me-
first, yes.
Just give me
Amita ji
one.
first.
Just give me
Okay.
1 second. Just give me
Okay.
1 second. Hang on 1 second. Okay, there you go.
Yes.
All right.
So what is PCOS? PCOD is polycystic ovarian disease, and PCOS is syndrome, means a group of diseases when occur, then it is polycystic ovarian syndrome. So basically, अगर मैं एलोपैथी एंगल से पूछूं तो पॉलीसिस्टिक ओवेरियन सिंड्रोम इज ए हार्मोनल डिसऑर्डर, सबको पता है, आजकल गूगल कर लेते हैं सब लोग। किसमें होता है? ज्यादातर रिप्रोडक्टिव एज में। और पता कब लगता है? या तो पीरियड्स नहीं आ रहे, या वेट बढ़ रहा है, फेशियल हेयर्स ग्रो हो रहे हैं, या आप कंसीव नहीं कर पा रहे, इसीलिए रिप्रोडक्टिव एज में। तो फिर आदमी जाता है इन्वेस्टिगेशंस के लिए कि क्या प्रॉब्लम है। The women with PCOS may have infrequent, prolonged menstrual periods or excess male hormone androgen level. Am I clear?
Yes, please go ahead.
Or excess male hormone levels due to which facial hairs occur. The ovaries may develop numerous small collections of fluid. छोटी छोटी फॉलिकल्स बन जाती है, क्योंकि ओवम कई बार ओव्यूलेट ही नहीं कर पाता, तो वो सिस्ट बनती जाती है, तो तभी पॉलीसिस्टिक, यानी पॉली मीन्स बहुत सारी है, सिस्ट मीन्स ओवरी में जो सिस्ट है, दिस इज पॉलीसिस्टिक ओवेरियन सिंड्रोम, जो ओवरी में होता है। और ओवरीज ये स्मॉल कलेक्शंस जो फ्लूइड की है इसको डेवलप करती है और रेगुलरली एग नहीं रिलीज कर पाती हर मंथ, अदरवाइज क्या है, ओवम रिलीज होता है हमारे मेंस्ट्रुअल साइकिल में, बट इस केस में नहीं होता। तो वो पॉली एक सिस्ट की फॉर्म में ओवरी के चारों तरफ या उसके अंदर डिपॉजिट होता जाता है, जिसकी वजह से सारी प्रॉब्लम्स होती है। एग्जैक्ट काज ऑफ पीसीओएस इज अननोन, ये एलोपैथिक व्यू में डिस्कस कर रही हूँ। अभी मैं नेक्स्ट आयुर्वेद पे आऊंगी, फिर मैं बताऊंगी इसके बारे में। और नेक्स्ट स्लाइड अमिता जी। यस, अब इसका डायग्नोसिस कैसे करते हैं? या तो ओलिगोमेनोरिया है, यानी कि पीरियड्स बहुत कम आना। एनोमिलेटरी साइकिल, जब किसी को कंसीव करने में दिक्कत आती है तो पता लगता है कि ओवम तो निकल ही नहीं रहा, जितना मेंस्ट्रुअल साइकिल टाइम पे आ रहा है कोई दिक्कत नहीं लग, सबको लगता है मेरे तो तभी पीरियड्स ठीक आ रहे हैं, बट एनोमिलेटरी साइकिल कि ओवम ही नहीं निकल रहा उसमें। हाइपर एंड्रोजनिज्म, यानी आपका एंड्रोजन का लेवल जो है वो नॉर्मल से ज्यादा है, दिस इज मेल हार्मोन, फीमेल्स में नहीं होना चाहिए ज्यादा, इसीलिए यहाँ पे मेल्स की तरह बाल आने शुरू हो जाते हैं, हिरोस्टिज्म जिसको बोलते हैं। पॉलीसिस्टिक ओवरीज, अल्ट्रासाउंड में आता है कि ओवरीज में सिस्ट है बहुत। टिपिकली ओवरीज जो है साइज में बढ़ जाती है, ओवेरियन वॉल्यूम बढ़ जाता है, और जो स्ट्रोमा है ओवरी का, जो अंदर का मटेरियल है वो भी बढ़ जाता है, उसका कैप्सूल थिक हो जाता है जो एक वाइट कलर में होता है, और उसमें काफी सारी 12 से ज्यादा मल्टीपल फॉलिकुलर सिस्ट होती हैं जिनका साइज अप्रोक्सीमेटली 2 to 9 mm है। ये एक सिर्फ डायग्नोस्टिक व्यू बता रही हूँ कि ये चीजें दिखे तो हम बोल सकते हैं कि इस पेशेंट को पीसीओएस। नेक्स्ट स्लाइड अमिता जी। यस, सिम्टम्स क्या है इसके? बहुत गंदे वाले पिंपल्स होते हैं पीसीओएस पेशेंट्स को, एक्ने हो जाते हैं, फिट। अब लोग सोचते हैं मुझे एज की वजह से, टीन एज की वजह से हो रहे हैं, बट उसका कारण पीसीओडी या पीसीओएस भी हो सकता है, इसलिए यू शुड विजिट डॉक्टर इफ यू आर सफरिंग फ्रॉम एक्ने। फटीग रहती है आपको, सब कुछ डाइट नॉर्मल ले रहे हो, सब कुछ कर रहे हो, बट इवन देन आपका दिल ही नहीं करना उठने का, मूड चेंजेस। एक्सेसिव बॉडी हेयर ग्रोथ, ये एंड्रोजेंस की वजह से है। इनफर्टिलिटी, ये मैंने बताया, ओवेरियन सिस्ट, क्योंकि ओवरी में सिस्ट हो जाती है। लो सेक्स ड्राइव एंड वेट गेन। नेक्स्ट अमिता जी। यस, अब इसका आयुर्वेदिक पर्सपेक्टिव क्या है? ये एलोपैथिक में बोल दिया कि इसका कोई काज नोन नहीं है, बट आयुर्वेद में कई डिजीजेस से इसकी सिमिलैरिटी है। जैसे कि हम बोलते हैं वात कफज आर्तव दुष्टि। अब वात कफज में आप सोचोगे वात कफज क्या है? आयुर्वेद में 3 टाइप के दोष हैं, वात, पित्त और कफ, जिसके बेसिस पे हम डिसाइड करते हैं कि आप हेल्दी हैं या अनहेल्दी हैं। अगर इन तीनों का फंक्शन प्रॉपर होता रहे तो यू आर हेल्दी, अगर उसमें कुछ भी प्रॉब्लम है तो आपको डिजीज होती है। तो जब वात और कफ की दुष्टि होती है, यानी डिफॉर्म्ड होते हैं अपने नॉर्मल फंक्शन से, आर्तव मीन्स मेंस्ट्रुअल ब्लड, तो ये प्रॉब्लम होती है। और उसमें होता क्या है? अबीजता ऑफ आर्तव। अब बीज मतलब ओवम, यानी जो बीज आना है, डलना है, वो निकल ही नहीं रहा, तो नष्ट आर्तव, यानी वो ओवम ओव्यूलेशन, ओव्यूलेटरी साइकिल नहीं हो रहे, एनोव्यूलेटरी साइकिल हो रहे हैं। ग्रंथिभूत आर्तव दुष्टि, यानी क्लॉट्स आते हैं बहुत, कई पेशेंट्स की कंप्लेंट होती है कि पीरियड्स में बहुत क्लॉट्स निकलते हैं मुझे। क्षीण आर्तव, कम मेंस्ट्रुअल ब्लड निकलना। स्थौल्य, वेट बढ़ना, अननेसेसरी वेट बढ़ता जा रहा है। पद्मिनी कंटक, दिस इज एक्ने। अतिलोमा, जो बहुत सारे बाल फेस पे हो जाना, तो ये आगे सेम वही सिम्टम है ऑलमोस्ट, पुष्पग्नि यानी वही ओवम ना निकलना, एंड डायबिटीज एक्सेट्रा। नेक्स्ट स्लाइड अमिता जी। तो जो जिन विमेन को पीसीओएस की प्रॉब्लम होती है, ज्यादातर वो रिस्क पे होती है डेवलप करने की डायबिटीज, क्योंकि वेट बढ़ रहा है, और उनकी कुछ हैबिट्स ऐसी होती हैं जिसकी वजह से पीसीओएस होता है, जो कि डायबिटीज के भी कारण है। तो और हाई ब्लड प्रेशर, क्योंकि पीरियड्स प्रॉपरली ना आने से आदमी का दिमाग घूमने लग जाता है। लड़कियों को ऐसे लगता है कि पता नहीं क्या, जब पीरियड्स नहीं आए 1 महीना, तो आपको लगता है पता नहीं दिमाग घूम रहा है पूरा। कार्डियक वेस्कुलर इश्यूज, ये डॉक्टर साहब एक्सप्लेन करेंगे ज्यादा डिटेल में। ओबेसिटी, वेट बढ़ना, एंडोमेट्रियल कैंसर, तो इनके लिए प्रोन हो जाती हैं वो गर्ल्स या लेडीज जिनको भी पीसीओएस की प्रॉब्लम है। मुझे लगता है मेरा
नहीं
एक
आप
और
नहीं आप
next-
please explain the early menopause, especially in Indian women, and then Dr. Taher will explain the consequences of this issue.
ओके, अब अर्ली मेनोपॉज पे आते हैं हम। मेनोपॉज एक बहुत बड़ा लाइफ का चेंज है लेडीज की लाइफ में, जिसके बाद कई लेडीज को तो ऐसा लगता है जिंदगी खत्म हो गई, मतलब इतना बुरा फेस सा लगता है उनको लाइफ में। तो अगर इसके बारे में थोड़ी सी अवेयरनेस हो तो शायद वो बेटर लाइफ जी पाएंगी। इसीलिए मैं आज दोबारा से एक बार कॉन्ग्रेचुलेट करूंगी विक्की को और नरेश डॉग को, जिन्होंने ये ऑर्गेनाइज किया। अब जो 40 ईयर से पहले जिनको मेनोपॉज हो जाता है, दिस इज प्री मेच्योर मेनोपॉज। और मेनोपॉज जो 40 और 45 के बीच में होता है, दिस इज अर्ली मेनोपॉज। ज्यादा 5% वुमेन जो है वो अर्ली मेनोपॉज के थ्रू जाती हैं, और मेन कारण इसका है स्मोकिंग या कुछ मेडिसिन या कुछ ट्रीटमेंट्स जो मेनोपॉज करती हैं। और इसमें बेसिकली सिम्टम्स क्या है? एब्सेंस ऑफ मेंस्ट्रुएशन, इरेगुलर मेंस्ट्रुएशन, इनफ्रीक्वेंट मेंस्ट्रुएशन, हॉट फ्लशेस आने शुरू हो जाते हैं, फिटीग लगती है, नाइट स्वेट्स, एसी चल रहा है फिर भी पसीने आ रहे हैं आपको, इनफर्टिलिटी तो नॉर्मल है, पीरियड्स बंद हो गए तो, नींद नहीं आती प्रॉपर, इरिटेबिलिटी, आप किसी की आवाज बर्दाश्त नहीं कर सकते, आपको लगता है बस शोर मत करो, मूड स्विंग्स, सेक्सुअल डिसफंक्शन, वजाइनल ड्राइनेस। बहुत सी शादियां खत्म होने का कारण ये रीजन बन जाते हैं। तो इसलिए अगर इनका प्रॉपर ट्रीटमेंट किया जाए और टाइमली अवेयरनेस फैलाई जाए तो इन सिम्टम्स को काफी हद तक कंट्रोल किया जा सकता है, जिसके बारे में मैं बाद में डिटेल में बताऊंगी।
All right, Dr. Taher, you're on.
Yes, I'm on.
All right, great. Please introduce yourself as well if you like, and then you can go on with the topic.
Okay. My name is Akil Taher. I'm a practicing physician in Atlanta, Georgia, in the US. And I am a resurgent physician, meaning that I believe in treating the cause of the disease rather than the consequence of the disease after it has happened. Meaning, if you've got high blood pressure, they give you medicines. I believe in not getting high blood pressure or cholesterol or chronic diseases in the first place. Okay? So now she explained very well the symptoms of menopause. And let me tell you, premature menopause is before 40 and early menopause is between the ages of 40 and 45. Now, she talked about hot flashes, night sweats, insomnia, mood swings, irritability, which is extremely common in menopause. But when it happens pre-menopause, we have to be worried about it. Some of the common factors contributing to early menopause, that is between the ages of 40 and 45, include the most important thing is lifestyle factors. So smoking is number one, poor diet, a caloric diet high in calories, your fats, your carbohydrates, your simple carbohydrate, not the complex, a diet of excessive meat, eggs, dairy, processed foods, sugar, salt, trans fats, which is still available in India, but we don't have trans fats in the US, and saturated fats. Of course, the American diet is called the SAD diet, the standard American diet, which is terrible. So all these can lead to as factors for early menopause. Now, having said that, another factor is low body weight. Women with very low body weight having disorders like anorexia, whereby a person goes on a fast or does not eat for weeks and months, and then whatever she eats, it's in younger females. What I've seen in my practice is then they start vomiting. That is called bulimia. And this cycle repeats. It is pretty dangerous. So here is where the psychiatric evaluation is required. Early menopause is one of the symptoms of that, but it can even cause death. So that's number one. And another one factor is excessive alcohol consumption. And third is a chronic stress. I want people to understand between this chronic stress and acute stress. See, acute stress is when your sympathetic system goes into overdrive. That means, say you're in front of a car and you're trying to avoid an accident. So what happens? Your sympathetic system overtakes, your blood pressure goes up, your heart rate goes up, your respiratory rate goes up, and you try and avoid it. The moment that danger, this is like putting your pedal on the gas. And once this is over, you put your pedal on the brakes. That means all these things come down. The blood pressure comes down when the event is over. Your heart rate comes down, your respiratory rate comes down. All this is normal. Now, if this is continued time and again in your life, this acute stress symptoms become your chronic symptoms. So you are under a chronic phase of blood pressure, diabetes, high sugar, and all that. This leads to more cortisol levels, which is an inflammatory process. And cortisol level makes you eat more. That means more obesity. Obesity leads to various things, sleep apnea and blood pressure and diabetes. All this is happening now with your symptoms of chronic stress. So that can also lead to the early menopause. Genetic factors, a family history of early menopause can increase the likelihood. Genetic mutations also play a role in early ovarian aging. Autoimmune disorders where the body's immune system attacks its own tissues, like you have in rheumatoid arthritis and other things, Hashimoto's thyroiditis, thyroid condition. And they can disrupt the normal function of the ovaries. Medical treatments, radiation, chemotherapy for cancer can damage the ovaries and cause early menopause. Surgical removal of both ovaries for medical reasons can do the same. Chromosomal abnormalities. You see, we have the XY chromosome in males. Females have the XX chromosome. One of the X chromosomes can be malfunctioning. So this can cause early menopause. Environmental factors, I believe, exposure to all these environmental toxins, your chemicals, your insecticides, your pesticides, all these can contribute to early menopause in very many cases. Viral infections, certain viral infections, mumps, viral hepatitis, even now, the COVID, they say, have been associated with an increased risk of early menopause. Certain medical conditions like galactosemia, whereby the sugar galactose is not properly utilized and it increases in the blood, causing ovarian malfunction. So we come to the next point. Early menopause in women can be associated with an increased risk of heart disease. Heart disease is my pet subject. So having gone through stents and bypass surgeries and transforming my whole life that I could do, as Amita said, I could do all these things, run 6 marathons. I've done your Mumbai marathon also. And I have done triathlons and bike rides, 100-mile bike rides after the age of 61. So, but let me tell you one thing, that early menopause in women can be associated with an increased risk of heart disease. And there are several reasons why. But before that, let me tell you, and take this as a home message. Heart disease is a leading cause of death, #1 killer in both men and women in the US, in India, and worldwide, killing more people than all the cancers combined. And the bad part of it is you do not have, I'm not trying to belittle cancer, I'm not trying to undermine cancer, no, but there is time for us to take the patient to chemotherapy, to let her buy a wig. In heart disease, 50% of the people die with their first heart attack. And people feel that it was a man's disease. No, it is a women's disease also. I have given a whole lecture for an hour, 2 hours on why women's symptoms are sometimes different from men's symptoms. They're subtle. You can have shoulder pain, you can have upper back pain, you can have shortness of breath, fatigue for long periods of time, but that's another issue. So coming back to heart disease, let me tell you, I think up to 2019, heart disease doubled in India. And India is a heart disease capital of the world. So we do not eat so much of meat and eggs and all that, but we have a lot of sugars and oils and saturated fats, which is causing dairy. So I personally believe a whole food plant-based diet can cure most of your problems, including your early menopause. So that is my belief very strongly. So we talk about hormonal changes. During menopause, the ovaries produce less estrogen, correct? So now estrogen has the endogenous estrogen. We're not talking about outside estrogen. Endogenous, the body estrogen protects, is a protective effect on the cardiovascular system. So it maintains healthy blood vessels, regulates cholesterol levels, promotes vasodilation, means dilating the coronary blood vessels which supply blood to the heart. And this decrease in estrogen levels during menopause can disrupt these protective mechanisms and potentially contribute to heart disease. And then you have the lipid profile. You can get high cholesterol total, bad cholesterol will be high, your good cholesterol will be low. This all creates a problem in the inner lining of your blood vessels, the endothelial lining, disrupts it, you don't get enough nitric oxide, there is no protection, and you start getting plaques and atherosclerosis in your coronary arteries. Again, one of the factors that leads to early menopause. Now, the next point is extremely important. It's increased visceral obesities. Folks, in my practice, I've seen Indian patients and South Asian patients having this combination of a very low good cholesterol, a very high triglycerides. It's a fatty acids with glycerol, so it's a fatty acid. And visceral obesity. If you look in India, people don't look obese, but they carry fat. They carry fat in their bellies. This visceral fat is extremely important because it is directly related to heart disease. Apart from it being for early menopause, it is directly related to heart disease. And this visceral fat is around your heart, in your liver, in your muscles. And no matter how much exercise you do, you cannot get rid of your visceral fat. It is only a diet, a whole food, plant-based diet, no oil diet can reduce your abdominal or visceral fat. So visceral fat is linked to insulin resistance. What is insulin resistance? You get sugar in your blood, it takes to the cells to be used as energy. But if as I said, if your fat blocks your cells, then your sugar goes over there, cannot be utilized as energy, comes back into the blood, and you get sugar. So that means you're insulin resistant. You get inflammation, whereby endothelial lining of your blood vessels gets berserk. An increased risk of metabolic syndrome, which 35 to 40% of Indians have metabolic syndrome, and they're not aware of it. High blood pressure, high blood sugar, visceral obesity, low good cholesterol, and high triglycerides. So your next point is blood pressure. What is blood pressure? It is your force of your heart throwing the blood at your arteries and your arteries trying to rebound. So if you've got nice elastic arteries, this will not be a problem. Your blood pressure will be 120/80. But estrogen helps in regulating this blood pressure by maintaining the elasticity and the function of the blood vessels. Again, endogenous, because remember, they did it in 1980s. They were giving estrogen orally to people who reached menopause. And it was disaster because it's outside estrogen is not what we are talking about. It is your endogenous, in your body, estrogen. So function of blood vessels and its decline during menopause, your blood pressure may lead to fluctuation in blood pressure, potentially contributing to high blood pressure, a major risk factor for heart disease. And it is crucial, therefore, for women experiencing early menopause to be aware of the potential risk and take proactive measures to maintain their heart health and heart healthy lifestyle, regular exercise, whole food plant-based diet, stress management, not smoking, avoiding substance abuse can be beneficial to your risk of heart disease. Now, having said that, early puberty, your periods, when a lady first gets her periods, early puberty has potential also with an increased risk of developing heart disease later on in life. And why is that? Because you see, ideally, you should be getting your periods at the age of 12, 13, 14. Nowadays, what happens? You get 9-year-old girls getting their periods. Why? Because of the outside estrogen, which is prematurely put into the body. Your dairy, you go and buy dairy. It is estrogen because your cows cannot make milk unless and until you inject estrogen and get them to be totally pregnant every time. So you are getting that estrogen coming from that, the antibiotics coming from them, the casein protein in the milk. All these are causes which can cause early puberty, has a potential of causing heart disease later on in life. So, and therefore, what we say is prolonged hormonal exposure, early puberty involves an early activation of the reproductive system, leading to an early release of sex hormones, including estrogen and testosterone. And prolonged exposure to these hormones throughout life may impact various physiological processes, including those related to cardiovascular disease. Thank you so much for listening. And I appreciate all of you being here. Thank you very much.
All right, so we move on to the next slides. Dr. Reena, you will take
Yes,
over
yes.
now. Talk about.
Yes. I have treated many PCOS patients with these Ayurvedic therapies, Panchkarma therapies, food as medicine, yoga, breathing techniques, naturopathy, counseling, and hypnotherapy. So these are the solution for this disease because, as Dr. Saab has also told, the main cause, this is the lifestyle disorder, which is very common in these days in US, in India, I think in every country. The modernization is pushing us to these lifestyle disorders. So for preventing these, we should correct our lifestyle. And if we are suffering from these diseases, we can be treated by all these pathies, which can be later contacted by Amita. Because I have a patient, I will discuss about one case history. First I will complete the slides, okay, then I will discuss.
Yes.
PCOS can be reversed up to some extent by holistic therapies. Up to some extent I have written because the facial hairs once developed cannot be removed, but other symptoms can be corrected by diet, medicine and exercise and other things, but early menopause cannot be reversed. So you should be active and you should follow all the dinacharyas advised in Ayurveda, that is the dietary regime and the lifestyle regime according to Ayurveda for a particular age, season, and all other things. I am giving an example here. For example, if you are an office worker, I have different diet and lifestyle for you. If you are a physical worker, means you are doing physical work, then there is a different diet and lifestyle pattern for you. If your age is different, you are in menarche, you are in young age, or you are in menopause, then there is a different diet and lifestyle pattern for you. So, and according to doshas also, Vata, Pitta, and Kapha. Sorry, I'm suffering from throat infection today, so my voice may not be clear. Due to the Vata, Pitta, and Kapha, there are 7 types of constitutions according to Ayurveda, on the basis of which we tell that which type of dosha is predominant, and then according to this, we advise diet and lifestyle. So we can take these advices from an Ayurvedic doctor, due to which we can prevent from all these diseases. Next slide, Amitaji. Yes, this is the case presentation in which the ovary size was 24 BC, and after treatment, this reduced to 5.2 cc. So this was irregular bleeding, then regular menstrual cycle occurred. This was treated by all these Panchkarma therapies and other things, and the patient is perfectly fine now. I am also saying one case study. I have treated a patient. A girl came to me. She is obese, and in very reputed hospital, they told her, "You will stay like this whole life. You will not menstruate properly." Then I done her Panchkarma, given her medicines, told her lifestyle and diet. Now she is perfectly fine, not taking a single medicine, menstruating every month on perfect date and for perfect periods. So this is the main thing which we want to convey you. Next slide, Amitaji. Yes, I think next is, yes. So Amitaji will explain this slide. Yes.
Yes. So the point was, to educate all of you, including all of us actually, and not to scare everyone. The thing what Dr. Taher and Dr. Arora is emphasizing again and again is lifestyle. And what we have done is we've partnered with experts such as Dr. Arora and Dr. Taher, over 2,000 experts from all over the world, and really want to help as many girls, as many women out there with holistic lifestyle. That's what I really want to talk about, and I want to open it up for questions right now. So what we've done is we've created these culturally sensitive holistic programs. Very important. Indian women, as Dr. Taher talked about, heart health is so important. They're getting into early menopause than anyone else in the world. And most of you are young girls, I see them. But if you don't take care of yourself now in your 20s or late 20s, you are prone to all these things that both the doctors talked about. So that's what we are saying in partnership with Vicky, offering these programs. And that's all I have. And I want to open it up for questions. But really, the whole idea is that how do we transform lives for Indian women in India as well as abroad? And if we partner, like with Vicky organization, like Vicky is a champion of women all over the world, we can drive change, we can transform lives. And that's the whole intention of starting this partnership for today. So with that, I'd like to open up everyone with questions. If you have any questions, we can take it for next 15 minutes or so. We don't want to sit here for 2 hours. So I will stop the share and we can open it up for questions.
Amita, Mehak will handle the chat box questions. She can take up the questions and the speakers
Okay.
can answer them.
Sure, please go ahead. And everybody can open up their videos if you want. We'll take a nice big picture. That's why I said that. So Sukriti will take a nice picture, right?
Sure. Mehak, you can start with the questions.
Thank you so much, Sukriti. Good evening, everyone present here. So I would like to take up with the questions. I hope I am clearly audible.
Yes. Go
Yes,
ahead,
you
please.
Yeah, thank you so much. So, Dr. Arora, I think most of the questions in the chat box are about how we can handle the stigmas and misconceptions amongst our surroundings, and what initiatives do women need to take, like initiatives like these. What more we need to do that we become more comfortable in our skin, and we become more comfortable with the topic of menopause and menstruation in general.
First question, you have told how to remove the stigma associated with this. I think this is not a stigma. First thing I will like to tell all the ladies, and if gents are also listening, be happy from inside. This thing should be present on your face. Don't see anybody else and do what your mind says. Ladies also should take the decision. They should participate in everything. Then I think for educated ladies, this is not a stigma. This is a biological change of your body, and your family should also accept, and your society should also accept, in circle in which you are living. They should be aware of the consequences of these diseases so that they are not creating trouble for you. I will like to tell you one thing here. According to Ayurveda, Vata is a dosh. Vat, Pitta, Kapha, 3 doshas, as I have told you. People say the symptoms of diseases कि ये खाने से वायु बढ़ती है, गैस बनती है, व्हाट्सएप पे मैसेज आते हैं, मैं भी देखती हूँ ऐसे, मटर मत खाना, गोभी मत खाना. बट आपको पता है किसी को स्ट्रेस देने से भी वात बढ़ती है. अगर किसी का, जैसे कोविड में कई फैमिलीज में किसी का कोई बहुत नजदीक के आदमी की डेथ हो गई, किसी ने बहुत अपना हस्बैंड खो दिया, किसी ने फादर खो दिए या मदर चली गई, तो वो जो आदमी उस स्ट्रेस से गुजर रहा है वो ऑटोमेटिकली उसकी वायु कुपित हो गई. तो अगर आप उस चीज में उसकी हेल्प कर सकते हैं, उसको निकाल सकते हैं बिना कुछ किए, सिर्फ मोरल सपोर्ट देके, तो उसकी वायु आप वैसे ही शांत कर सकते हैं किसी भी चीज के बिना. तो ये सभी को समझना होगा कि आप सोसाइटी में, स्पेशली लेडीज, क्योंकि ये प्रॉब्लम को जो फेस करता है उसको सबसे ज्यादा पता होता है कि आप दूसरों की हेल्प कैसे कर सकते हैं. और सेकंड क्वेश्चन एक बार रिपीट करो महक आप प्लीज.
मैम, इट वाज रिलेटेड टू हाउ कि हम स्टिग्मा और मिसकंसेप्शन कैसे कम कर सकते हैं और अपनी स्किन में कैसे मोर कंफर्टेबल हो. आई थिंक आपने बहुत अच्छे से वो आंसर कर दिया.
बस वो अपनी स्किन में किसी भी चीज में कंफर्टेबल होना लेडीज को आना चाहिए. हमेशा किसी की बात सुनने की आदत मत डालो. पहले अपने दिमाग में जरूर सोचा करो कि इसका क्या आंसर होगा. शायद आपका आंसर आपके घर वालों से ज्यादा बेटर हो और वो सुनना शुरू करें उसके बाद. अगर आप हमेशा सुनते रहेंगे तो फिर ये यूज नहीं होगा, इसको जंग लग जाएगा. बी हैप्पी. सबसे पहले कभी कभी अपनी खुशी देखा करो कि आप कैसे खुश होते हैं. जब बचपन में एक बच्चा होता है ना, वो बहुत खुश होता है क्योंकि उसके ऊपर कोई टेंशन नहीं होती, उसके ऊपर पेरेंट्स होते हैं. लेकिन जैसे जैसे बड़े होते जाते हैं, आजकल मैंने देखा है इतना ज्यादा स्ट्रेस है सबको, और आधी से ज्यादा प्रॉब्लम ये स्ट्रेस भी है इसमें, जो बहुत बड़ा कारण है. पीसीओएस में भी, अर्ली मेनोपॉज में भी, मेनोपॉज अगर बिगड़ता है, तंग करता है, उसमें भी. तो उसको कम कीजिए, मटेरियलिस्टिक लाइफ थोड़ी सी कम कीजिए और स्पिरिचुअलिज्म में ज्यादा जाए तो आप बेटर हेल्थ को पा सकेंगे। थैंक यू।
Good evening, Dr. Taher. My immense pleasure to talk to you. I would like to take up the questions on behalf of everyone present in the meet. So the question, what everyone wants to ask to you is how to avoid early menopause and early puberty in a generation like us who is getting so much more exposure, and also how to increase good cholesterol in our diet.
Okay, first let me thank Dr. Arora. आपने बहुत अच्छी तरह समझाया stigma वगैरह, तो मैं very, very happy about that. Now, and number two is that you must remember that plaque formation, atherosclerosis, that happens in your coronary artery starts at the age of my grandson's age, 8 to 10 years. So if you don't follow certain guidelines and rules at that age, and if you're constantly going to eat a double whammy, our own Indian food, which is not the village food is great, but our own Indian food of saturated fat, dairy, and all that, plus having all these westernized foods of your Burger King and McDonald's and all that, is a dynamite. So
Yes.
the number one is that you have to remember the 6 pillars of lifestyle medicine and take this seriously. 6 pillars start at a very young age. The first pillar of lifestyle medicine, the cornerstone of lifestyle medicine, is nutrition, which is complemented by other 5 pillars. So you start your first pillar. We were not meant anatomically, genetically, or physiologically to eat meat in the first place, period. So in my opinion, you should become a whole food, plant-based diet. If you can't do that, then cut back and become a flexitarian. Cut back on your meats, eggs, dairies, and other foods. That's your number one goal. Number two is exercise. You cannot be doing exercise, 30 minutes of strenuous exercises in the morning and then sit on your desk for the rest of the day or sit on your couch. That is what I did when I was making my life in my early days, and I got a heart disease. I was a couch potato. I ate everything at sight. I was called a seafood eater, SEE. Whatever I saw, I ate. You name it and I've eaten it. But now I've transformed my life. So my only muscles that I exercised those days were my eye muscles, looking at joggers run in the park, or my hand muscles, using the remote to change the TV channels. But if you are going to exercise in the morning, see that you move your body throughout the day. Number three is your stress level. Everybody has stress. Our Prime Minister Narendra Modi has stress. Our Biden has stress. They know how to handle stress. We should learn how to handle stress. We have been given things to handle stress. Like your meditation, yoga, it started in India. Meditation, yoga, spirituality, sky breathing. You know, when I did your trekking or your yatra, Mount Kailash, I did it on foot. 19,000 feet. And when I went up there, I realized that material things were nothing. They are here today and not there tomorrow. The peace I got at that moment cannot be put into words. It's my wife who noted the change in me when I came down. So get that into it. Third, after that, is restorative sleep. 7 to 9 hours, if you're not getting sleep, there is something wrong. If you are sleeping for 11 hours and getting up tired, that's not restorative sleep. You can sleep for 5 hours and say, wow, I want to go ahead and now do things. That's restorative sleep. Finally, what you have is a good social support. See, we in America don't have this. You in India have that support. the social support. We get very lonely at times over here. There's single families. Of course, we have friends and all that, but in America, it is a very different issue. So you have the social support. And finally, avoid substance abuse. All that they said about alcohol, the second question that you put, increasing your good cholesterol, and it's all humbug. It's all nonsense. Alcohol does no good for anybody for health reason, period. This was a Harvard study done 6 months ago. Now, if somebody tells me that I'm drinking because socially and responsibly, I am not a judge, because I do have a glass of wine now and then. So I'm not going to be a judge on that. But don't tell me you're doing it for health reason. You're not doing it for health reason, period. Smoking, pain medication, whether it is prescription by your doctor or street drugs, all this is gone. If you follow the 6 principles of medicine, you're great. Now, when you have high triglycerides and a low HDL, which I saw in a lot of my Indian patients, and a visceral obesity, you raise your HDL by exercising. You cannot have medications for raising up your good cholesterol. Your bad cholesterol, you have medication, but your good cholesterol, you do not have medication. And your triglycerides, come on, reduce all this fried food, saturated fats, have complex carbs like your quinoa or amaranth or your brown rice. Stop eating all this junk food. I did it. And it cost me. I don't want any one of you 100 people ever to get a heart disease and your chest being open. It's not an easy thing. So read my book also, that 7th chapter of my book, Open Heart, why diet is more important than exercise. It has already got some 250, 300 excellent reviews on Amazon. So read that. And did I miss any point in your questioning, my dear?
No, sir, not at all. You are truly an inspiration, sir.
Thank
Sir, the next question what the audience would like to ask you would
sorry
be that
to interrupt. Wait, I think Reena has raised her hand from a very long time. Ma'am, do you have anything to add?
Yes, I want to ask, are there any specific kind of exercises which can help us to delay PCOS and early menopause? Or some specific yoga asanas which we can do target these issues?
Yes. Specific yogasans are not needed for delaying these. You can do normal yoga. But yes, if you are suffering from or you're prone to disease is existing in your family, then you should at least consult a doctor for all the dietary and lifestyle advice.
Okay. And one more thing about exercising. Remember that you have to incorporate 4 types of exercises in your. It's not only aerobic exercise. Aerobic exercise is meaning that you are cycling or you're walking or you're dancing, biking or swimming. All these are aerobic exercises. But you should also do muscle strengthening exercises. Here in America, we have seen people who go to supermarket stores and start parking the car closest to the gate. Why? Park the car far off and walk. That'll help you. And then you get your the trolley or the cart and put all your things in the cart. Why don't you carry it with your hands? You'll get this thing for especially older people. Muscle. Do wall push-ups.
So is it go to the vegetable market and carry all vegetable bags on our shoulders?
Of course. Why not? We
got I've been doing this, and many people told me, don't do this. This will hurt your back. You will get back problem and all.
You are not going to get anything. If you get anything, take my name and sue me in the court. Okay, but I am telling you, you're not going to get anything. You have to build up your muscles. Your core body strength should be built up. The third thing is your balance. As we get older, you all are young people. As you get older, your balance goes off. And if your balance goes off, you get hip fractures, osteoporosis. And if your osteoporosis, hip fractures, is 1/3 people with hip fractures die. 1/3 survive with a very poor life. Only 1/3 people actually survive with a good life. So these are important things, your balance exercises, your aerobic, your muscle strengthening. If you do all these things properly, you're a winner. I've been doing it. I've been doing 3 miles a day. I've got a back problem, but I don't let that define me. That is not going to kill me. My heart is going to kill me.
Thank you, sir. Thank you so much.
You are so welcome. I'm enjoying myself. I hope you all are all enjoying yourselves.
Definitely, sir. It's such a great experience to listen to you too.
All right, so we can take a few more questions and then just wrap it up. We don't want to be sitting too much. Like Dr. Taher said, we were sitting like a couch potato, so we don't want to be sitting, all of us, like couch potatoes for another hour, right? I'm taking Dr. Taher's advice very seriously now. So couple of more questions. Anyone? You know, everybody looks young, I think. So I think this is a very just the right kind of a topic for all the young people out there. So Sukriti, what other things that you have?
I think Tishika has something to add. She has
Okay.
raised her hand.
Okay.
I have a question to ask, like, how will we differentiate between having PCOD and like delayed periods? Because I have been in this position and usually I'm quite confused that am I suffering from the, disorder, or is it like just because like I'm having delayed periods due to certain reasons?
I leave this to Dr. Arora.
Yes.
All right.
Yes. PCOD will be diagnosed with the symptoms I have explained. If with delayed periods you're also suffering from those symptoms, then it may be PCOD, but you should visit a doctor if you are suffering from delayed periods for complete checkup and whole history. Because this is a personalized system of medicine, and on this platform, I cannot say that you are suffering from PCOD or this is simply delaying of periods.
All right. Thank you, ma'am.
Welcome.
Mahink, do we have any more questions?
I think we can go on with just 2 more questions, if that's
Sure,
all.
go for it. Sure.
So one of the major questions from Dr. Arora was that how does hormone replacement therapy or other hormone treatments for menopause interact with our PCOS or PCOD, and how do they impact the overall health of a woman?
First, I will like to say one thing, that these are not totally successful. I have seen many patients. Till the time you are taking these hormones, your period comes. When you leave this treatment, again you're suffering from same problem. So the holistic therapies are far better than these things. And the second question, Mahek?
Yes, ma'am. Like around the hormone replacement therapy only, like how
Yes,
does that impact, and how
Yes.
does that?
And Dr. Saab has also indirectly answered this question, as he has told about estrogen, that we need the inside estrogen. Although we also give phytoestrogens to the menopausal ladies, they help up to some extent, but the inside material cannot be compared with outside medicines.
Okay, let me just say this. If we were giving estrogen therapies to a lot of people at menopause during our 80s and 70s. And what they realized that the heart disease increased tremendously. So I will go a step further than Dr. Arora. I believe that no estrogen should be used.
So have you heard about phytoestrogens?
That's it. That's different. Phytoestrogens are different. That you can find in tempeh and tofu and all your soy products. That is a different issue. But I'm talking about the estrogens
No,
that
I
they
am not
give.
saying about chemical estrogen. I am saying about those things.
No, I'm saying I'm going a step further, meaning that you are right, but I'm going a step further to say that absolutely no, I would not want estrogen therapy because of increased heart disease.
Yes.
So we suddenly stopped giving estrogens. Now, phytoestrogens, which is there, that is tremendously, it has great benefits to the body, but that should be also coming from natural sources.
Yes, yes.
Not from the outside sources. The only two supplements that you require if you are on a vegetarian, whole food, plant-based diet are your vitamin D and your B12. Nothing else is required because all the nutrients, micronutrients, macronutrients comes into if you are taking a whole food, plant-based, no oil, sugar, sweet diet, no processed sugar. So I am on a whole food plant-based diet. I don't do outside sugar. I do my dates and my raisins. And you should taste my leek soup and all that. Maybe I should have become a chef and give up my job as a doctor. So, and become a chef. I don't know. But I believe that nutrition, food either fights disease or feeds disease.
Yes.
So remember that. No disease that can be treated by food should be treated by any other means.
I extend. Yes, sir.
Any
हाँ,
other
बोलिए.
question?
So I was just concluding it. I mean, it was a great session. I think on behalf of everyone, I would like to say that all these learnings, we'll take it up, and I think they will continue to be with us for our life.
अच्छा वही चीज हिंदी में बोल.
सर मैं yes sir, of course, why not sir? So I think कि मुझे लगता है कि जितनी भी learnings हमने आज ली हैं वो हमारे साथ पूरी लाइफ टाइम रहेंगी, एंड अगर लाइफ टाइम रहेंगी तो शायद लाइफ टाइम इंक्रीज भी हो जाए.
वेरी गुड.
अगर मेरी लाइफ टाइम में रहेंगी, मेरा तो अभी 5-10 साल है, तो भी बहुत है मेरे लिए.
आप ऐसे नहीं कहो, आपके अभी बहुत साल है.
अभी तो बहुत.
बिल्कुल सर. So we need doctors like you more and more.
Yes.
शुक्रिया.
All right.
आप दोनों हमारे लिए great inspiration थे. I think now Amrita would like to conclude.
Anything else, Sukriti? All right, or anything else from Vicky?
Amrita has something to add.
Sure, please go ahead.
As we draw near the end of this remarkable talk show about menstruation and menopause, we can't help but feel a sense of profound gratitude and enlightenment. Today, we have taken significant strides in dismantling the barriers of silence and stigma surrounding these crucial aspects of life. The knowledge shared by our esteemed speakers has been nothing short of enlightening. We have gained valuable insights into the science, emotions, and experiences associated with menstruation and menopause. Through their expertise, passion, and dedication, they have empowered us to embrace these natural processes with compassion and understanding. We extend our heartfelt gratitude to our exceptional speakers for their invaluable contributions, igniting a flame of enlightenment in our hearts. Their passion and commitment to empowering individuals have left an indelible mark on this gathering. To our cherished audience, we thank you for your openness and engagement. Your presence and participation have been the driving force behind the success of this event. Let us continue to be allies for menstrual and menopausal health, supporting one another on this journey of understanding and acceptance. As we conclude this talk show, let us carry forward the torch of awareness and empathy. Let us be the advocates for change, creating an environment where everyone can access accurate information, supportive resources, and respectful dialogue about menstrual and menopausal health. May the conversation sparked today continue far beyond these walls, resonating in homes, schools, workplaces, and communities worldwide. Once again, thank you all for being a part of this transformative talk show. Thank you, everyone.
All right. Thank you. So, well, that was very uplifting, igniting all of us. I think it was very beautiful. So, what I want to say is, and I see that I can talk on behalf of Dr. Arora and Dr. Taher, is we want to take this whole education to millions and millions of women out there in India, and we are hoping that Vicky and Nourish Talk and the doctors here, we can all take it together and transform millions of lives beyond the 100 people today. And we are hoping that Vicky can help us take this torch forward, right? That's really why Nourish Talk has been created, a holistic wellness platform. That is what Dr. Arora is trying to do. That's what Dr. Taher is trying to do. We have joined hands and we've created this amazing platform to really take this education. So I'm hoping to all the Indian women out there, and we are working right now with a lot of NGOs. I want to take this to the rural woman out there who is uneducated, and I'm seeking Vicky's help. All of us are seeking your help. How do we take it further, right? So let's have a discussion afterwards. I want to genuinely thank you. I don't have a speech written, but from my heart, I genuinely want to thank Dr. Taher and Dr. Arora for always supporting us, and to Vicky. Amazing, amazing. All of you have been just nothing but amazing. Dr. Taher and Dr. Arora, please, would you like to say something?
Yes, I will like to say. I will like to say on this platform that there are some things mentioned in Ayurveda, Rajaswala Paricharya, the menstrual regime which we should follow, Garbhini Paricharya, the antenatal care for the pregnant ladies, and there are some procedures by which 99% normal deliveries occur. These are described in Ayurveda, and many patients come to us. So you are a ladies organization. Nourish Doc is also doing very good for holistic therapies. So you can spread these words so that people are more healthy and happy and with the good life. So this is my message to all of you, that follow Ayurvedic lifestyle and dietary regime and be healthy. And contact Nourish Doc for further programs. Thank you.
Dr. Taher, last words from you before we wrap up.
I would like you to go to YouTube and watch one of my, there are a lot, 20, 30, but watch my Women and Heart Disease.
I will share that with everyone.
Okay. Number two is that I would like to say, which is my saying, adventure may hurt you, but monotony will kill you. Now, over here, adventure is a metaphor. I'm not asking you all to climb mountains like I have climbed or do marathons, but take up something different, which you are more accustomed to. Get outside your comfort level. Play a game of bridge, or do some cooking, or do some gardening, or take up bridge, something that is outside your normal values, and life will be much better. You will stop thinking about other things, worries, and all that. So with that, adversity may either be your best friend, or adversity can be your worst enemy.
I think,
okay.
I think we beautifully, I see people are just joining now. We are ending the session, but I think we all have to say, how can we make a difference in our other women's life? And that's all my focus is, and that's all my passion is, and that's what I think Vicky's passion is. And together, my humble request is that let's join, all of us join together and make this, to take it to as many millions of people, women out there. That's all. With that, thank you so much, everyone, for joining. Anyone else, last words? I'm going to wrap up and end the session. Before I end the session, anyone else wants to say it? All right. Well, thank you again, Dr. Taher. Thank you again, Dr. Arora, and thank you, Vicky, for being with us, all of us. Together, I think let's just make a pledge that how do we take these messages to more women out there? Thank you.
Welcome, Nourish Talk, for partnering with us. It was a great session. We got to learn many more new things. Thank you so much, the doctors and Amita.
All right. Bye-bye. Thank you.